Hello, everyone. This is your host, Susan Rosen, and I have a guest today by the name of, oh my God, I forgot your first name.
David, yeah.
David. That's my brother's name. You'd think I would remember that. David Sherazi. And David is a dentist and acupuncturist, and has a couple of practices in Los Angeles, and you also have a research facility.
I do.
And you also have some interesting special. I was going to say specialties, but that's not exactly the way that you say it, right? Special practices,
focuses,
areas
of focus,
areas of focus that that you deal with and work with and help people with. And I think personally, it's something that I'm very aware of. And also, I think for most people that are over 50, even if they don't realize it, really could use some help in this area. So why don't I will turn that over to you, and you can explain all of that, and then we can have a little conversation.
Well, lovely. Well, thank you for having me on your show. The subjects that we're going to be talking about directly influence those over 50. So I think it's a good match. My practice is limited to the treatment of snoring and sleep apnea and TMJ disorders as they're related to many things. Like we were talking before the show about how tension type headaches and migraine type headaches can be associated with clenching and gnashing of the teeth. And I do a form of orthodontics called functional orthodontics, which is sort of like what you would do to a child, for example, when you couldn't do, let's say, appliances. Like you would use, like for example, functional orthodontics, if done appropriately, can literally cure sleep apnea in a child. What we can't say cure very often in our field. Even taking out tonsils and adenoids in children doesn't cure it. It reduces it if it's inflamed, but it doesn't cure it like functional orthodontics can.
Do you hear a funny
a buzzing?
Stop. Yeah.
Yeah, sorry. That was me.
Okay.
Yeah.
Oh, that's okay. I thought who knows with all the electronics. Sorry, didn't want to just to interrupt you.
Yeah, no, and that's it. So my focus is with sleep, and sleep, and again, I don't say this to be facetious or to put pie in the sky notions. This is I'm a clinical researcher, so I take these words very seriously. Sleeping, getting regular, productive sleep, is more beneficial to one's health than diet, exercise, and even psychotropic medication to treat anxiety and depression. It's one of the greatest things you can have is good sound sleep.
That makes a lot of sense.
Yeah.
Because I think the other issue is that a lot of people, particularly over 50, even without those issues, have other issues. I know I had a period in my life where I was supporting my mom, who was in her 90s at the time, and I would end up having to rush her to the emergency hospital at 2:00 in the morning.
Mm-hmm.
And then that was it. I got no sleep.
Mm-hmm. Yeah. And then trying to function the next day.
Yeah.
Without it. Well, there's two specific stages in our sleep. One is delta, one is REM. Delta is where we get over 90% of our growth hormone. Okay. So in children, obviously, we need growth hormone to grow. But after we've reached our genetic potential for growth, we then use growth hormone to repair physically repair tissue. Like after a workout, after an illness, we need growth hormone. And with REM, that's where we get our memory consolidation and our emotional processing, right? Which is so huge. And then, like as I was saying, those psychotropic, many, if not nearly all of the psychotropic meds, doesn't matter if it's SSRI or otherwise, they actually retard REM sleep and actually cause people to clench their teeth more.
Oh,
incidentally.
interesting.
So kind of like the opposite of what you actually need.
Yeah, that's I don't think that's that unusual in
Yeah.
life these days. Especially with so many people self-prescribing things.
Yeah.
Do this
Yeah.
or do that or whatever. I mean, I'm just as bad as a lot of them. So
Yeah. I mean, people are just trying to figure things out as they go along. They go to
mm-hmm,
their doctor. Most physicians will prescribe a medication.
mm-hmm,
There is very little in conventional, what we call allopathic medicine. There's very
mm-hmm.
little, let's sit down and try to figure out why you're having this problem. There's very little of that. It's mostly, well, here's a drug. Let's see if that does it, or pacifies you. Okay. And if it doesn't, then let's see if we can justify a surgery, to take something out. So it's, I'll tell you, I have a family member whose husband was in medical school. I won't name the medical school, but it's a very prominent medical school,
Uh-huh.
and no different than any traditional medical school today.
Mm-hmm. Okay.
And I asked him a very loaded question. I knew I was asking him a loaded question, and I said, "So, are they teaching you anything about diagnosis these days?" And he said, "Oh my God, all day now, all I'm doing is case studies, case study after case study. That's all I'm doing." I said, "All right, give me an example of a case study."
Mm-hmm.
He goes, "Well, this patient came in and she had these constellation of symptoms and, it turned out to be hyperthyroidism." I said, "Okay. So why did the patient have hyperthyroidism?" Right? And he's got a blank look on his face. And I said, "Well, the patient didn't have hyperthyroidism 10 years ago. So why is she in your office today with hyperthyroidism, doctor?" And again, like a blank look. And listen, the guy had a master's in neurology before he went to med school. He is really smart. Okay.
Mm. Yeah.
And my wife is a pharmacist, and she's like the yin to my yang. So she would say, "Dave is asking about the origin of disease," right? And he still couldn't get it. So I switched into professor mode, and I asked him like they would in med school.
Uh-huh.
And I said, "Okay, so what are some of the known causes of
Mm.
hyperthyroidism?"
Mm-hmm.
And he goes, "Well, it could be genetic." I go, "Okay, less than 10%. What else?" He goes, "It could be iodine deficiency." And I said, "Great." And my cousin says, "Well, what's the answer?" I said, "Well, he just told me the answer or the possibility."
Mm-hmm.
And he looked at me like I was crazy, and he goes, "Iodine deficiency." And I said, "Well, if the blood test shows the patient has hyperthyroidism, and that's a fact, and that iodine deficiency can cause hyperthyroidism, why wouldn't you prescribe it and see how the patient responds?"
Mm-hmm.
Okay.
Mm-hmm.
Because the alternative is you take out all or part of the thyroid and you put them on a medication like Synthroid for the rest of their lives.
Yeah, which is
And
not
and
good.
I mean, sometimes it's a necessary evil, like when people have cancer. Sometimes it's just
Yes.
necessary.
Yes. Yes.
But
Yes. Yes.
but I said, the thyroid kind of regulates, female hormones. So while you're trying to figure it out in 6 months, while you're trying to find out what the right dosage is for that patient, her hormones are going all over the place. She's going mental, right? I said, imagine that's your wife. Would you even want to live with someone while they're going through all that emotional stuff? Why wouldn't you just give him some iodine? There's no side effects to this.
Yeah.
Right.
Yeah.
And he, to this day, we hardly ever speak. He didn't like that. This was literally over a decade ago.
Oh no.
And
Oh no.
but you understand, he's not unique. This is
No.
a
No.
common thought process. Is
Yes.
okay.
Yes.
So the blood work, the way the patient speaks about their mental health, that is the diagnosis, and they're very good at finding out the exact thing you have going on.
Mm-hmm.
And then when it comes down to actually trying to resolve it,
Mm-hmm.
most of the time they don't.
Mm-hmm.
They just want to pacify what's happening, as an emergency state. So, and once you take a thyroid out, you can't put it back in.
No.
Once
And it doesn't grow back either.
It doesn't. Well, it can if you leave some of it behind, but it's rare.
Okay.
And once you take a gallbladder out, for example, it doesn't grow back. So these are things that affect like your whole life.
I had my appendix out.
Yeah.
They don't grow back. to this day, I'm not sure that anybody even knows what appendixes are there for. I don't.
Oh, we know what they're there for. It's
Oh
not a
yeah.
secret. Yeah.
Okay.
It's a lymph node.
See, I didn't know
So
that.
the gut, as you know, is our it processes food, but it also
Everything else too.
it's everything else. It also is a huge source of our immune system. Like 80% of our immune system comes from the gut. But sometimes that flora can get, in a bad way.
Yeah.
And so the purpose of the lymph nodes is to pick up, your immune response and, pathogens response and store them up so they don't become systemic. Right. So the problem is sometimes they don't know. The problem with lymph nodes in general is that they don't, if they get stuck, then they have a hard time releasing them without any intervention. And so what ends up happening is they can explode, right? And then, it could be very bad if it's in your gut and your gut explodes.
Yeah. Oh yeah. No kidding. Yeah.
Right.
Yeah.
But,
Well, and
but
I was a little kid, so yeah.
I'm sorry?
I was a little kid. I think I was 10, 12, somewhere in there.
Okay.
Yeah.
Were you constipated or always? Okay. Okay. Okay.
Yeah.
Yeah.
Yeah. Yeah, it's funny. I was actually watching one of the videos. Actually, it's the video, I guess, the Google video that's on your website.
Oh, okay. Yes.
Yeah.
The Google Talk. Yeah.
Yeah. And I didn't actually get to watch very much of it, but I was watching some of it. And it was interesting because one of the things that I guess you talk about, and we can talk about, is about how important it is for mothers to breastfeed.
Yeah.
And I know my mother didn't breastfeed me. I don't think she breastfed my brothers either, to be perfectly honest. I have 3 older brothers. But for me, when they took me, actually, they literally took me out. They did a cesarean and they did a full hysterectomy at the same time.
Okay.
So she didn't do anything after they took me.
Yeah.
Right.
She was recovering. Yeah.
Yeah. Yeah. And back then, we're talking long recoveries.
Yeah.
Because I'm 66 years old. So life was a lot different in many ways, but the same in probably a lot of other ones as well. But yeah, it was much, much different. So
yeah. And one of the purposes of breastfeeding, in addition to developing the oral apparatus and learning how to swallow food and developing your palate, but one of the main purposes is to line the gut flora with healthy bacteria, right? The first year of a child's life, they don't really have an immune system, right? It's a very, very immature immune system. But it's so rudimentary, it's picked up by the gut, right? So for example, moms that can't breastfeed, you can actually get like goat milk, which is almost 100% identical to human breast milk. You can get probiotics and put it in Similac and give the child, some healthy gut flora. That's part of the the issue with it is if you don't have the proper gut flora, you can have things like constipation. Because you need it to process.
Yeah, and I'm sure I didn't get any of that. I can guarantee it. Yeah. So, yeah. Oh well, life is fun. You deal with what you got, right?
Yeah, it's all. I'm sure we can find people that had it worse and people that had it better, but right. We just deal with what we have, and we do our best to choose to make the best of it mentally as we can. That's it's always a choice.
Yeah. Oh no, absolutely, and that and that's part of what I've done as well is just learning more about health and learning more about the things that have enabled me to be better and for my body to be better. So, yeah, my mother, Yeah. She did give me one other thing though that I'm not sure I wanted, but she had lots and lots of allergies, and I picked up a lot. Actually, all four of us got her allergies, so
Yeah.
I got all of her. They call them food sensitivities now, um, but they're essentially allergies. They just don't show up in a skin test.
That's right. But there is a blood test you can have done that'll tell you exactly what they are.
Right.
And exactly how reactive you are to it. And I think everybody should have it. I think everybody.
Yeah.
The lab I recommend people go to is called Meridian Valley Labs. They're out in the Northwest. And it's called an IgG4 food sensitivity panel. And it'll tell you what, what it is. I have a family member that one of my doctor friends did the study on for her. And she had a very, very high level of lemon, of all things. I've only seen lemon come up once ever in my life. And she's Persian, so she's squeezing lemon on everything.
Oh my God.
Yeah. So she doesn't know. Who would ever think that delicious lemon juice would be would be inflammatory to the gut? But that's just it, finding out what it is. Like, wheat, dairy, eggs, soy, and corn are usually the top offenders.
Right.
And even me, like, so for example, I don't have a reaction to wheat. My genetic ancestry is Persian Jewish, and we date back to the Babylonians, and we invented wheat, right? So I think that's why I'm okay with it on the test. However, because so much of the wheat that we have now is so processed and has been genetically altered, I still react badly to wheat. I have to be very cautious about what I eat when it comes to wheat.
Yeah. I can't do wheat. I can't do cow milk. I can do and beef is kind of iffy as well. I think it's kind of anything from a cow. But even though I do everything organic, so there's not a lot of the chemicals and stuff that are in so many of them.
Yeah.
But yeah, those are the two. I can do goat milk and sheep milk.
Good.
All of that.
Beautiful. Yeah, but, me too. And your body really, very few people have a sensitivity to goat milk and goat cheese. Some have it to sheep. It's not terribly common, but you can. And the reason why, people have a problem with cow dairy and beef is, I don't know if you know this, but in Europe, they have cows just for beef and cows just for milk.
Yeah.
And in England, they have cows, particularly bulls, just for their leather.
Okay, that part I didn't know, but I knew the other, yeah.
Well, the reason why they picked the bulls is because the female cows get stretch marks when they have babies, and that makes the leather less quality. So they go with males for their leather. But here in America, the top consumer of cow products is in the hamburger industry, right? And these are all corporate decisions that were made, where they said, well, we need the beef and we need it to stay the same taste. And, these cows are expensive. How do we lower our costs? It's like, well, if we hybridize these beef cows to these milk cows, then we'll collect milk from them for several years before we, slaughter them and make hamburgers. And so they did make a profit that way. But what they've done to, the environment and the climate and the ecosystem is really, truly unforgivable.
Yeah. Oh, no, absolutely. Especially the way they raise them. And
the factory.
It's not even living. I mean, it's so disgusting.
It's horrific to watch. It's horrific to watch. I agree. And I hope that this information becomes more widespread and people understand what's going on. Now, but there is a difference, though, between pasture-raised beef and wild beef. Yeah. Yes. And not wild. Sorry, I meant factory farm beef. I've been looking at some documentaries, and I don't know why this is, by the way, but for some reason, for the last 20 years, every documentary I've seen is they'll have great information in there, really important information in there, but then they'll throw in some half truths or lies, which I don't understand. Like when Michael Moore came out with that Fahrenheit 9/11, which is very
Yes.
damning of what the Bush administration did,
Yep.
and Bush's ties to the oil in Saudi Arabia. Then they put in some really factually wrong information in there, which helped to discredit all the good information that was accurate in there. So they came up with this vegan movie on Netflix last year. I can't remember the name of it. Really great information, very science-based. They talk about the benefits of having a more vegan lifestyle, especially over 50. Right? And then they'll say something like, oh, it doesn't matter if you have factory raised beef or pasture raised beef, they're all the same. Right? Which is so inaccurate. And then they also said that soy products increase your testosterone as opposed to your estrogen.
That's
which
an
was
old myth.
It's I couldn't believe after all the great stuff that they were saying, they switched to that, which to me discredited the rest, you know. So I don't know why there's a trend.
Isn't
they
that
don't
weird?
fact check. It's a document. Like if you're making a fictional movie, you don't need to fact check yourself.
Right.
But if you're making a documentary,
yeah,
have it fact checked.
Oh, God. That is, yeah, it's mind blowing. It really is. So let's go back to the whole sleeping and snoring and all of that, because obviously you and I could go on for a lot longer talking about all these other
life.
all these other issues, and I actually would love to do that sometime, because we're obviously on the same page, and you have much more information than I do. I mean, I know probably a lot more than most people, but that doesn't take much to do that these days.
So what aspect of sleep would you like more knowledge in? What do you think your viewers would like to know more about? I'm happy to discuss anything.
Well, I think probably, you know, there's a lot of talk about sleep apnea. I know that you in particular have kind of put it all together with the teeth grinding and the apnea and so many other things that are all in that area.
Right. So, well, let me start with like what sleep apnea is. So the apnea part of sleep apnea is when we hold our breath for 10 seconds or longer. Okay. And another aspect is called hypopnea, where we have shallow breathing that causes oxygen to dip 3% or more. Okay. We, in a sleep study, whether we do it at home or in a lab, will tally up all the apneas and all the hypopneas divided by the number of hours someone is sleeping, actually asleep, and we get a score. We call it the AHI. And from that, we determine if they have, you know, no apnea, mild, moderate, or severe. Yeah. Okay. Now, what's interesting is, you know, relative to pretty much all the other specialties, sleep, and particularly sleep apnea, is only about 40 years old. All the other industries are a couple hundred years old in Western medicine. And by the way, Ayurvedic medicine, Chinese medicine, those are 5,000 years old and plus. But Western medicine is about 200. But with sleep apnea, we thought, okay, the problem was the loss in oxygen, right, from holding your breath or the shallow breathing. And of course that is a factor. But what we're finding is the most relevant point of sleep apnea is what's called arousals. And what that means is when we're in a deeper stage of sleep, like the delta and the REM I talked about at the beginning, when we get kicked out of that stage of sleep, right, into a lighter stage of sleep, right? And having those arousals is associated with every inflammatory disease I know.
Wow.
Right? I have not found yet anything that isn't related to that. Even like you would think, oh, well, it's not related to cancer. Well, we now have literature shows that patients that have sleep apnea and cancer have a 5 times greater chance of dying with their
Wow.
cancer if they already have sleep apnea. So there's most of it is indirect, but it can be directed. Like, for example, we know high blood pressure can be caused by sleep apnea. We know type 2 diabetes can be caused by sleep apnea.
Wow.
We know anxiety and depression. And the reason why we know this is, well, first of all, there's thousands of studies, but once we follow up, once we have a patient that has both, you know, hypertension or type 2 diabetes or whatever, and sleep apnea, once we get around to treating them with either CPAP or oral appliance therapy, when we remeasure them, most of the time their type 2 diabetes either improves or goes away. Their hypertension, their blood pressure comes down, usually within normal. Of course, their diet is a big part of that as well. And their anxiety and their depression greatly improve.
Wow.
Right. So we see it just result. That's why I say it's more effective than diet and exercise and psychotropic drugs, is because you're actually kind of treating the cause, letting your own body's ability to repair itself come through.
Okay. That makes sense.
Yeah.
So is there a difference just between plain old, or is there a plain old snoring versus apnea, or is it all under the apnea? Really?
So, I mean, all of it, we have subsets of it, right? I mean, we even have something called central sleep apnea, which is your brain telling your body not to breathe.
Oh, lovely.
It's not a physical obstruction, you know, in the throat. So with snoring, I mean, we don't have to describe what snoring is, right? It's the sound. There is an aspect of sleep apnea called upper airway resistance syndrome, where you hold your breath for less than 10 seconds and your shallow breathing doesn't cause oxygen deprivation, but it kicks you out of a deeper stage of sleep. It causes an arousal, right? And that is the aspect of sleep apnea that's been associated roughly 50% of the time with people that clench their teeth. Right? So, and that's why we see whenever we resolve the apnea with the CPAP or oral appliance therapy, they stop clenching. It reduces their ability to clench. Not 100%, because like we said, you could be upset about something that day. You know, if, for example, we just talked about, you had a food sensitivity. Let's say you had a wheat and dairy. If you go and eat a slice of pizza, you're going to clench your teeth. Let's put it that way. Anything that stimulates the autonomic nervous system can make you clench your teeth.
Interesting. Yeah. Well, and it also makes sense because, like, for me, and I'm probably not alone on this, a lot of the time I will get more congestion in my sinuses, which means that I'm not breathing.
That's correct.
As well.
That's correct.
So it just goes right down the hill, right?
That's right. It can lead, it's one of the main causes of people having sleep apnea. It can even be related to that central sleep apnea, because when we switch from nose breathing to mouth breathing, we get rid of too much CO2. And the only response the body has to restore your CO2 is to stop you from breathing, let your metabolism restore your CO2. Now, coming back to the arousals, there was a study done in, I believe it was Cleveland Clinic, with 1,100 subjects. And what they did was they did sleep studies on both the husband and the wife. Okay. And what they found were predominantly, not, you know, I'm making generalizations to kind of give a summary of what happened in the study. And it wasn't only the men that had apnea and no, but generally speaking, that was the case. So the men that had sleep apnea with their wife bed partner that didn't have sleep apnea, the husband had an arousal index of 27 arousals an hour associated with their apnea. The wives with no apnea had 21 arousals an hour from the husband snoring, and not just the snoring, but the holding of the breath is it's like you're used to the sound and then it shuts off. And you'll see people will jerk in their sleep when their bed partner does that. So of the 1,100 subjects, they whittled it down to 150 people that stuck and used the CPAP religiously, right?
Okay. Mm-hmm.
And they asked their bed partners, okay, who didn't need treatment in anything, right?
Mm-hmm.
Who didn't have apnea. They said, so now that your bed partner is wearing a CPAP every night, how are you doing?
Uh-huh.
Right? They're like, well, there's been no other changes in my life other than the machine. And, my mood is better. My headaches are gone. My kids tell me I'm much more agreeable. And we saw a secondary response from
Makes
the bed
sense.
partner not being woken up 21 times an hour.
Yeah. 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 I mean, they may as well have apnea themselves, right?
There is logic in that. There is
Yeah.
logic in that. Yeah.
Wow.
Yeah.
Yeah. That's interesting. Yeah. I know that I snore when I'm on my back.
Yes, that's most common.
Yeah. Not on my side.
And especially when you can't breathe through your nose.
Yeah.
Mm-hmm.
Yeah. Well, and I do clench my teeth.
Yes. That's very common with mouth breathers as well. Yeah.
Yeah. Yeah.
So I would say, talk to your doctor about it and do a sleep study for yourself.
Mm. Okay. Yeah.
There's no harm in it. They get more data from that sleep study than any blood test. It's it's a great amount of information that comes through. Checks your heart, checks your breathing, checks your brain waves. It's lovely.
Interesting. Okay. And then, yeah, it's actually it's funny because when you talk about with couples, right? So many things are have to do with couples down line things.
It's true.
Yeah, but my husband's always, not always, but every once in a while he'll try and wake me up.
Yes. He does the elbow jab.
Yeah. Yeah. And sometimes I have to wake him up, even though he swears he doesn't snore. But he's funny. He's the opposite. He does it on his side.
Yeah.
Not on his back. I've never known anybody who did that.
Yeah, if you have a tonsillar issue, that could be the case. It is most common to snore more and have apnea more when you're on your back.
Yeah. Yeah. Interesting. Okay, I guess I should do that. I'm not sure. I'm not sure I can handle the CPAP thing.
Well, don't assume. Don't assume that.
No. I'm just saying. I think the other one that you were saying, or that I saw in your
the oral appliance. What I use. Yes, this is what I have myself and what I treat from my patients is an oral appliance. Now
that would make sense to me because I'm already putting a mouth guard in. What's the difference?
Exactly. It is a little bit more bulky. Because it's a top and bottom piece. Okay.
Yeah.
But it's a great alternative to CPAP. So here's the generalized numbers in terms of success. So a CPAP is roughly 99% successful in treating sleep apnea when you wear it. It's not tolerated very well. So the adherence to CPAP is about 50%, roughly. With oral appliances are 75% or so at resolving sleep apnea. But they're tolerated 75-80% plus of the time because it's just a matter of putting it in.
Yeah.
Right. If you can remember to do so. So it's, I always joke in my lectures that it's like the difference between ointment and suppository. It's like, yes, a suppository will work way better than ointment, right? But you got to do that. You got to put it in every night, right? So for some people, like for patients that have very severe sleep apnea, their only choice is CPAP or surgery. There is, an oral appliance is usually not indicated for severe sleep apnea.
Yeah. No, and that would make sense. That would make sense. Yeah, I don't. Well, I'm not going to say I don't think I have the extreme.
Right.
sleep apnea because I'm not, I don't wake up in the morning tired or
Yeah.
anything like that. And and most of the time I don't even wake up and have to go to the bathroom occasionally.
Okay.
But I do end up I keep going back on my back, even though I get on my side and then I end up on my back.
So there is actually a phenomenon called positional apnea.
Okay.
Where it only exists when typically it's on your back, but it could be your side as well, but it only exists when you're on that position.
Yeah.
Right.
Yeah. Which is when I'm on my back. I mean, that's when
So they sell shirts with like a reverse fanny pack on it.
Oh, I have heard of that.
Or they'll duct tape tennis balls right down the spine so that it hurts to sleep on your back.
Okay, to retrain you.
So to train you to sleep on your side. Yeah.
Yeah. Yeah. Does it work?
Yeah, if it does, if you can tolerate it. Yeah. So there are some people, usually people that are more heavy set, that they'll still end up sleeping on their back with it, and then they wake up with back pain.
Oh no.
Right.
Then they get used to it, sort of.
It's sort of that. Well, their desire to sleep on their back outweighs pain of it. But I think for the most part they do work if you have positional apnea. And again, you getting a sleep study.
Yeah, would tell you all that. Yeah,
it's just a great thing to do. It's just a great thing to do, and that you can have it done in your own bed. You don't have to go to the lab.
Oh, okay.
What I tell patients when they're trying to decide which one they should do, I'll tell them, okay, listen, if you have not just sleep apnea but a whole bunch of other conditions like insomnia, for example, and you're the kind of person that when you go to a hotel, like on vacation, that first night you don't sleep right, you need a couple of nights to get used to the bed and the environment, you should definitely, do it at home. But if you have, like, what I said, if you had other medical conditions, insomnia and all that, and you're the kind of person that can just put your head on the pillow and go to sleep anywhere, definitely do it in the lab. It's way more data.
Okay.
Right. And there's literally someone watching you as you're doing it in another room, making sure you're okay, and making sure, all the sensors are on you correctly, and scoring your study manually in real time. It's a tremendous amount of information. These sleep technologists are just living legends. Like they're shift workers, so they have to sleep during the day.
Oh my God!
And work at night. And they usually are seeing 2, 3, or more patients a night. Wow. And they have to monitor these all at the same time. And they just have to be on top of it. And it's amazing. They have to make sometimes life and death decisions, in real time, because the doctor's not there.
Yeah. Oh my God. Wow. Yeah. Huh. Interesting. Yeah, I'll have to look and see. I have Kaiser, so I don't know what they cover or don't cover.
They do both. It's been my experience that they actually prefer to do home sleep studies because it's cheaper.
That's what I'm saying. I'm not even sure they would do it at all. So,
you know what? If you, God forbid, had severe sleep apnea, you would demand an in-lab study. You would demand one, and they have to give it to you. They have, and if they don't have it in their facility, they have to pay for someone else to do it.
Interesting. Okay. Yeah. Well, keep that in mind. I don't think I'm quite at that level, but you never know, right? It's done.
Yeah, just go. I mean, I always tell people, it's like, why play guessing games, right? Yeah. That's also a problem in my profession. Is once they have the diagnosis, once the dentist makes an oral appliance, they don't do a follow-up sleep study on the patient, like refer them back to the doctor and please test my device, see if it's working. They'll go by patient's anecdotal recount, or they'll go by like a journal, or they'll go by what the bed partner says. These are not accurate. These are not accurate at all. Yeah. And the modern, technique is to use like a Fitbit or something like that.
Oh no.
I haven't seen. I know the technology is improving. I have yet to see something that is like that. That is a real improvement. That is a real game changer.
Wow. No, that would make perfect sense.
Yeah.
Um,
Yeah.
Wow. Huh. Okay, we'll have to check into that.
Yeah, please do.
Yeah. Yeah. No, I would love to stop clenching my teeth.
Yeah. And you know
if
what?
Nothing else.
if you do decide, for example, if you do decide to go to a sleep lab and get it done, feel free to take your husband with you. You'll each have your own bed. It'll be something you guys will do together, and just get it tested.
Yeah.
You know. But if you're doing your home sleep study, I would advise, if you're doing your home sleep
One
study,
at a time.
Do it. Well, you can do them both the same night, but just sleep in different rooms.
Yeah. Well,
because the microphone's going to pick up the both of you.
Right. I was going to say, and you'd end up waking each other up at various times and not at the same time.
That's right.
Right. And so it's not going to be accurate.
Yeah. Mm-hmm.
Yeah. Which makes perfect sense. Mm-hmm. We have to think about that. Okay. Okay. Sounds good. Mm-hmm. So, anything else? We've been talking for a while. Could probably, maybe if you want to do kind of a little wrap up on what you think the takeaways that people should.
So just value the importance of sleep. Okay. Know that you cannot monitor your sleep yourself, meaning you're unconscious during sleep. So you don't know what's actually happening in your sleep, but you know well enough to know, you've been in your body your whole life. You know well enough to know if you didn't get as many hours as you should. You know well enough to know that when you got up, you're yawning like that, and you don't feel restored, then you should make a change. Make sure the room is darker, and make sure the room is on the a little bit on the colder side. Make sure the bedroom that you use is only used for sleeping and sex, nothing else. No eating, no family arguments, no kids playing in there, just only sleep. That's it. So those are the things you want to do, what's called sleep hygiene, to make sure your bed is good. And then if you have a clenching disorder, headaches, migraines, and you don't feel rested in the morning, they could all be tied in together. The reason why my office and the other 65 offices we have throughout the world are called the TMJ and Sleep Therapy Center is that it's very hard for us to find a TMJ patient that doesn't have some kind of sleep breathing disorder at night. And it's very hard to find a sleep apnea patient that doesn't have some kind of jaw problem because they've been clenching at night as well. So that's there too. And if you want more information, on my website, TMJLA, you can go there, click on either sleep or pain or orthodontics, and there's a plethora of great information.
Yep. And I will put that link in the show notes as well for people.
Wonderful. Well, thank you for having me. It was delightful having this chat.
Thank you. I've learned a lot.
Okay.
So, which of course is all I ever care about. But yeah, but it's interesting because I think even though we were talking about, for people over 50, but I really think that it applies to people of all ages. And really, the earlier you can get this taken care of, and under control, the better off your life is going to be.
So, I agree.
Yeah.
I agree wholeheartedly.
Yeah. So even if people are over 50 listening, hell, if you've got kids or whatever, and turn them on to it as well.
I'll even add this, since you mentioned kids. Remember those 2 stages of sleep I talked about, delta and REM? In adults combined, they're supposed to make hopefully 50% of our sleep. Okay? In the infant, those 2 stages of sleep make up nearly 100%. of our sleep. We have very little stage 1 and 2. And as we get older, we start creeping up more stage 1 and 2. But like even a pre-adolescent child is going to need more delta and REM than an adult will. And when they have even a little bit of apnea, it has a much more profound effect. A little apnea in a child is like severe apnea in an adult.
Wow.
Yeah. So thank you for bringing that up.
Yeah. Interesting.
Mhm.
Yeah, because there's also a lot of people, who watch this who have grandkids
Yes.
also.
Yes, absolutely.
So, anyways, okay. Well, let me just finish off by saying that I am not a doctor, and this is not medical advice, per se.
Best.
And
Absolutely.
yeah, and that if you are having any of these kind of issues, please go see your own doctor.
Yes.
And if you're not getting any help there, then go find another doctor who can at least help you, or who
Okay.
specializes in this area.
I agree.
So that is it for today, and thank you very much for joining me for this. I do appreciate it.